How does stress affect the amygdala in addiction? Have you ever wondered why stress seems to make addiction so much harder to overcome? The answer lies in a small but mighty part of our brain called the amygdala. Let's break down how stress impacts this area and its connection to addiction. The amygdala plays a key role in processing emotions and stress. When we face stress, especially if it is ongoing, the amygdala can become dysregulated. This means it doesn't function as it should, leading to increased activity. This heightened activity can amplify how we respond emotionally and make us more sensitive to stress. In the context of addiction, this increased amygdala activity has several important effects. First, stress can trigger cravings for drugs. When the amygdala is activated, it retrieves memories related to drug use. This means that even after a person has been sober for a while, stress can bring back strong memories of drug use, making cravings more intense and increasing the chances of relapse. Additionally, stress can make it easier for drug-related memories to form and be stored in the amygdala. These stronger memories can make it much harder for someone to resist drug-related cues. This can lead to compulsive drug-seeking behavior, where the individual feels they cannot control their desire for drugs. Chronic stress also changes how the amygdala works. It can impair the amygdala's ability to regulate emotions and control impulses. This can lead to poor decision-making and increased impulsivity, which are common traits in addiction. The amygdala does not work alone. It interacts with other brain regions like the prefrontal cortex, which is involved in decision-making, and the nucleus accumbens, which processes rewards. When stress causes the amygdala to become overly active, it disrupts this network. This can weaken self-control and reinforce addictive behaviors. Interestingly, the effects of stress on the amygdala are not limited to substance use disorders. They can also extend to behavioral addictions, such as internet addiction. In these cases, altered amygdala connectivity can affect how emotions are processed and lead to addictive patterns. Understanding how stress impacts the amygdala in addiction highlights the importance of managing stress in treatment and recovery. Strategies that help reduce stress can lower amygdala activity, which may decrease cravings and the risk of relapse. Therapies that focus on emotional regulation and improving control over the amygdala can also lead to better outcomes for those facing addiction. In summary, stress affects the amygdala by increasing its activity and changing its structure and connections. This leads to stronger cravings, reinforced drug memories, impaired emotional regulation, and disrupted brain networks involved in addiction control. Recognizing this connection is vital for anyone looking to understand addiction better and find effective ways to cope with it.